Hello, and thank you for joining us today to prepare for Virtual Advocacy Week. Today, we are focusing on advocacy, ensuring that all advocates have the tools and answers they need to successfully contact Congress. With us today is Philip Goblis II to discuss more about crafting your story in a clear and concise manner. Thank you for discussing with us today, Phil.
Thanks, Claire. It's good to be here.
Alrighty, so let's get started. How long should my story be?
That's a great question. And I first want to start off by thanking you for participating in advocacy. Your work is incredibly important to helping us advance the RLS priorities here in Washington, D.C. I'll just briefly, mention, we've gone over this in other videos, but sharing your story and using your voice to elevate the needs for support is critically important. And it greatly complements the work that I do here in Washington, D.C. on behalf of the foundation and the community's behalf in terms of making sure that Congress supports key priorities and federal agencies are advancing critical items as well. So your story should really be focused on, what has your experience been with RLS? How has it affected your life? What obstacles has it created? What have you seen change in your daily life? What is the overall effect that RLS has had on your daily activities and in your life in general? I know some folks are always weary about, how much detail should I go into? We normally recommend for folks to keep their story to about 3 to 5 minutes, 5 minutes at the max level. And this would help you in any sort of meeting setting. For those of you who have come to DC in the past or met with your local office, you know that you don't have a whole lot of time to meet with them and to go over stuff. So it's always good to allow for a good question and answer conversation with staffers who may want to follow up on some key items, or for you to be able to touch on other things, is to have your story be about 3 or 5 minutes, where you hit some key points and just think, if you were to, come across your member of the House or your senator, one of your senators, what would you want them to know? What is the most important thing that they should take away from that conversation about RLS? And that's where you can really focus to keep it short but concise, concise and comprehensive, to make sure that you're covering all of the key points. How were you diagnosed? What were their obstacles to being diagnosed? How do you deal with your RLS? Are there treatments that you're using? What obstacles do you have to those treatments? So we always recommend taking everything that you've had and really try to whittle that down. And please do always consider us a resource and trying to help you to create a very effective, again, concise but comprehensive are my two favorite ways to describe your story, to be all-encompassing of key things that you want them to know, but making sure you're also having that opportunity to strike within a limited window that you have with staffers or with members themselves.
Awesome. This goes into the last question, just a little bit deeper. I have had RLS for years. How do I craft a meaningful story in the time given?
That's another great question. And again, I think it's been my experience that it's important to bring that personal side of it, because what we're talking about in terms of funding levels for the National Institutes of Health, we're talking about billions of dollars, and we're talking about different policies across federal agencies. And there's a lot of dollars and cents that gets associated or attached to these requests. And we're talking about different programs and different activities. All of that can get lost on a member or their staff when they're just thinking about the bureaucracy of everything. What really drives things home is putting that personal touch to it and seeing that while we're talking about billions of dollars, that pales in comparison to the actual experience that one of my constituents has had and is currently dealing with. So for those of you who have had RLS for years, it's always important to share with members and their staff what life was like before your diagnosis. What symptoms did you have leading up to your diagnosis? How were you diagnosed? Did you have any obstacles to being diagnosed? Were you misdiagnosed? Were there any issues around that? That leads to our push for greater education and awareness to better understand what RLS is. So that way, when you, present certain symptoms, you're more likely to be correctly diagnosed instead of misdiagnosed and have to continue to search for an answer. what has your journey been? What have been the high points? What have been the low points? Again, you really want them to understand what a day in the life of an RLS patient is, and the effect that it has had on your life, whether you're a patient or a family member or a caregiver. So again, I would look to what were your experiences pre-diagnosis? Did you have any challenges leading up to diagnosis? And how do you manage your RLS now on a daily basis? If you've been an RLS patient for 20 years, how have you managed the past 20 years? How have you been able to maintain as close to a daily routine as possible while dealing with the RLS? How have you had to adapt to certain situations? I've heard from many folks that they've had to make different adjustments to work schedules or to other things. So just talking about how having RLS has affected your daily life and your ability to do certain things is very meaningful in that time. And I know that we talked about having that 3 to 5, limit in terms of crafting your story. Don't ever be afraid of going over that. And I know that this may sound like a contradiction to everything I just said at the beginning of this video, but I have been in meetings and I have been parts of discussions where staffers are very engaged or members are very engaged and they want to know more. So sometimes you may go on for more than 5 minutes, but as a general rule, we recommend keeping it to that 3 to 5 minutes and hitting those key points as part of your story.
Awesome. And this also tags along, this last question tags along to the other ones that I've asked, but what do our representatives want to hear from us?
They want to hear why it's important. So the question of why should they support increased funding for the NIH? Why should they support sleep disorders and restrictions in the Department of Defense's peer review medical research program? Why should they support chronic disease education and awareness? Your story is the why to all of our requests. And again, I've mentioned in previous videos, the work that I do here is, front facing. I'm in the weeds of policy and the technical side of everything and just the bureaucracy of dealing with the federal government. What you as an advocate bring to the table is that personal side. It's a face to the issues that we're talking about. And representatives just want to hear, how has your life been affected by this? And why is it important that they support more funding? Why is it important that they step up as a champion for the RLS community? Because they're doing it on your behalf. So it's very important for your representatives to hear, again, that full spectrum of everything you've had to deal with. And you really, when you share your story, drive home the importance of them supporting our key priorities. So it's critically important that they do hear from you, because you are their constituents, you are who they represent, and they want to make sure that they're representing the interest of their district and of their constituents in their states.
That was perfect. Thank you, Phil, for wrapping that up for us all nice and tidy with the bow. Thank you so much for everyone for joining us today and sharing your time with us today, Phil. You can watch more of our advocacy videos on our website underneath the Get Involved tab, and we hope to see you at Virtual Advocacy Week. Thank you, Phil.
Thanks, everybody. Thanks, Clara.